First, as I get started, I want to say how honored I am to be here to speak with all of you about such a really important topic. My name is Jen, and I'm sure you can hear from my accent, from Canada. Yes, that's right. Love our neighbors too. So I'm from beautiful Nova Scotia, Canada, and I arrived in New Zealand in 2019. January, when the world changed with my husband and two children to do my PhD at the University of Auckland. And we fell in love with New Zealand, and we're still here. So I'm a dietitian, pending registration in New Zealand. I have my master's in health promotion, and I'm currently almost done that PhD. And what you might learn from all of those things is I am seeking answers. I am looking for the answer, which means that in this 10 minutes, I don't have the answer. But what I do have, and what I'm really excited to share with you today, is lots of questions. And I think this is something that worldwide we are looking to change how we approach weight management. And I think talking about it and starting the conversation is where we're going to be. So are you guys ready to get started? Yeah. All right, let's do it. So what are we going to unpack today in this 10 minutes? We're going to talk about what it is, because I think this definition is really important. Our language in this space matters. How we talk about it matters. So let's start the conversation, and by the end of this 10 minutes, I hope all of us together start to rethink how we approach it. Sorry, the button, there we go. So how do we define weight management? So let's start with the word management. If I was to go over and manage the temperature in this room, what would I do? I'd just go press it up or down. If I was to manage something, you'd think I'd have control of that thing. Unfortunately, how much control do we have over our body weight? So if I was to eat an apple, does my body weight move right away? So that can be incredibly frustrating for people when we're going through that journey. So intuitively, weight management, even the terminology, can be quite frustrating. So let's take a look. I have a map as well. So what is this map? This is the Foresight Obesity map. It's actually from 2007, I think. But I present this map at every time I talk about weight management. And I think it's really important that we look at this map and see the complexities here. So I don't expect you to read it, but I read it for you, and it's quite complex. So in the center, I think I do have a pointer. In the very center here is our energy balance. And all these lines and boxes are things that affect that for individuals. So my body weight is affected by all sorts of different things here. It could be the infrastructure in which I live in, my genetics, my culture. My mom wasn't a very good cook when I was a kid, so we focused not so much on food, and that's how I grew up. So when we look at the way that food and how we interact, this is very complex. So I'm not saying this to say, okay, now what do we do? But it's really important to see the complexity of which weight management provides. Because when individuals start to manage their weight with eating healthier and exercise, it takes a while, and there's some other non-modifiable things that are going on that we need to support individuals with. So how do we start the conversation about such an important thing? The first thing, I have 3 little tips, is we think about bias with weight. And the way we have been taught as a dietitian, when I started my education, we talked a lot about what we eat and what we don't eat. And individuals, we did meal plans, and we counted calories, and we focused on how to support individuals with that. But things have changed, and going back to that map, there's all sorts of things that affect our body weight. Diet and exercise is important for each and every one of us. But it can be challenging to focus on solely that for our weight management. So weight bias and discrimination, which is rampant in our schools, our workplaces, and our healthcare system. And we need to take a look at what that is, because the bias we don't know about is actually the bias that is the implicit bias that can affect how we move forward in this space. So being aware of it is the first way to reduce it. So how do we reduce it? And I also want to bring, this one. I want to bring attention to this picture here, which was from a very recent conference. And it's about internalized weight bias. So we have weight bias within our society, but we also have individuals who have internalized our weight bias. And internaling weight bias doesn't affect it doesn't get a better response. We need to manage that internal bias, which is when we reduce it within us, we support individuals with reducing it within themselves. My personal PhD research was in the area of compassion, but specifically self-compassion, to start to remove that internalized bias as we move forward in managing weight. So it's putting people and whānau first, watching our language and listening to the language that people use, and also advocacy and allyship. So how do we do that? We're curious. We ask questions, we learn, and we listen. So when individuals come to see us, they most likely have tried to engage in weight management before. And I think that's really important to consider. Also, we want to look at weight management as something people would like to consider right now. A lot of times people have things going on, if they're in pain, if there's something more urgent, that will be what individuals will want support with first. The other thing that we need to do is as healthcare professionals, and I know this for myself, we want to jump in and provide support, provide information. But it's really important to take a step back and ask questions first. So this actually comes from SCOPE, which is the World Obesity Center, and some of our colleagues in Canada have worked on the 5 A's. I put this up here, and it actually could take me an entire 5 minutes to talk about it, so I'm not going to go into detail, but it's really about asking questions, asking permission. Is this something you'd like to talk about today? And that just plants the seed. The next part is assessing their story. So understanding where people are coming from. So going back to that map, seeing where people are in that, what is affecting weight in that space. Advise on management if that's where people would like to go. And this is where multidisciplinary teams can be really supportive in this space. And if people are comfortable with that, agree on goals. And at the last, assist with some of those drivers and barriers. But in order to do all of that, I think the most important thing for us to do is to assist with compassion. So understanding that there's a lot of factors involved, and we're just getting started in how do we rethink how we manage weight and body weight. So starting with compassion, self-compassion for individuals, but also self-compassion for ourselves as healthcare providers. So here we are. Are we ready to start rethinking weight management? So I'm going to leave you with 3 questions. The questions are, what does weight management currently look like in your practice? We all work in weight management. It is a really important part of what we do. What could it look like? And then most importantly, how do we get there? So this is a paper that I wrote with my colleagues here in New Zealand and in Canada, so if you're interested in taking a read. And if you'd like to send an email or contact, again, I don't have all the answers, but I'd love to connect and start a conversation. That's it for me. Thank you.